Hello, my name is Meredith Stutz, and I'm a student physical therapist at Duke University. I'm here to discuss racial disparities in breast cancer, as well as pose some action items to reduce these disparities. The information provided is not all inclusive. There is still much that we need to know and learn about breast cancer for women of color, but it is at least a start. 1 in 8 women will be diagnosed with breast cancer in their lifetime. 1 in 8. This means that about 12% of women in the United States will develop breast cancer, and the disparities in breast cancer begin even prior to diagnosis. A study performed by Orji and Yamashita in 2021 found a discrepancy in the women who are likely to receive a mammogram at their yearly checkup. Women not receiving proper screening measures are therefore more likely to be passed over and missed by the healthcare system. This is further illustrated by the study done in 2015 by DeSantis and colleagues, who found that Black women have the largest proportions of later stage breast cancer at diagnosis compared to women of other races, leading to lower survival rates. Taking this a step further, Ellis and colleagues in 2018 showed that non-Hispanic Black women have the largest proportion of triple-negative breast cancer compared to all other races. Triple-negative breast cancer is more aggressive and has a poorer prognosis than less advanced cancer types. And this can be seen in the graph on the right. Even still, Black women experience lower survival rates and higher risk of death for all stages and types of breast cancer compared to white women, which can be seen on the left. Poverty, lower levels of educational attainment, and lack of health insurance are associated with lower survival rates due to limited access to care. A study performed in 2020 by Coe and colleagues found an association between higher stage cancer at diagnosis and being underinsured or having Medicaid. And after fully adjusting for socioeconomic status and insurance status, this association was attenuated toward the null. The impact that social determinants of health have on breast cancer for women of color is astounding. On the left, you can see that social determinants of health accounted for over half of survival rates for women of color. Over half. It is one thing to know that there are racial disparities present. It is even more important that we do something about it. The APTA Oncology's vision statement is to optimize movement and quality of life of individuals impacted by cancer and chronic illness. This is exactly what we can and should be doing, starting by getting involved in the communities and that you are treating. You need to know who these people are before we can even begin to help. We can use our position as healthcare professionals to promote regular physical activity and healthy lifestyle behaviors like healthy diets to reduce cancer risk as well as improve cancer treatment outcomes. We can educate our patients on the importance of yearly screening, especially for the higher risk groups of women. We can also teach our patients how to perform monthly self-exams to monitor changes in their breast tissue. A good example of this is provided below this video as a link. We need to leverage our positions as professionals to advocate for expansion of services for these populations of women. An example of something already being used is the patient navigator position through the Patient Care Connect program at University of Alabama, Birmingham, to help women navigate our healthcare system in order to reduce delay in or the lack of care. More examples seen on the right are also provided in links below this presentation. If you choose to financially support people diagnosed with breast cancer, make sure you do your research ahead of time. You need to ensure that your donations are going to research efforts or directly to the patients themselves. The list on the left includes a few foundations that are highly reputable. For example, donations to MetaViver go directly to research on metastatic breast cancer, which is more commonly experienced by women of color. On the right, there are a few resources that can be provided to patients for prevention, as well as after diagnosis. The links to these are also provided below this presentation. A great one for support, as well as general tips, is a blog called For the Breast of Us, which is run by and for women of color. The bottom line is this: there are populations of women who are not receiving the level of care that they deserve. There are women that are looking to be and need to be seen, and we can do something about that. Thank you.